Hi everyone, this is John Mandrola from the Heart.org Medscape Cardiology, and I'm here at the ACC meeting in New Orleans, and I'm pleased to have Dr. Alex Voskoboinik from Melbourne, Australia, and he presented today a very interesting study on alcohol and atrial fibrillation. Alex, welcome.
Thank you for having me, John.
Tell us about the primary results, the top-line results first, and then we'll get into the details of the study.
Yeah, so essentially the primary results were that in moderate drinkers with atrial fibrillation, so classified moderate as 10 standard drinks per week or more, abstinence from alcohol resulted in a significant reduction in AF burden, reduced recurrences, and also had secondary benefits including improved blood pressure control and some weight loss as well. So that was sort of our key findings.
That is key. This is very important. Tell us how you came about the background of thinking about this.
Yes, I guess lifestyle intervention has really come to the forefront in the last 5 to 10 years, and we've always had an interest in, in primary prevention. I mean, obviously, lots of money is spent on AF ablation, and we've got toxic drugs, and I think if we can give our patients some sort of additional recommendations that may, circumvent some of those things, I think that would be really important. And there's really sort of a gap in the literature in the sense that we've always known that there's been a relationship. There's a number of observational studies looking at alcohol and AF, both with respect to substrate, the atrium, and also as a trigger. But to date, there have been no randomised studies looking specifically at that question. And as many of the patients, many AF patients are in their middle ages, and alcohol is ubiquitous in society, I think it was important to look at, particularly in those sort of more moderate levels and heavier levels, what sort of difference that would make if we pursued a strategy of significant reduction or even abstinence.
Right, so you all have published a very kind of elegant paper showing that reduction of alcohol can actually change atrial function.
Yeah, we looked at 75 patients using detailed high density mapping, and we found in multivariate analysis that the heavier drinkers, so the average there was about 14 standard drinks per week or more, did seem to have indication of more atrial substrate for AFs with conduction slowing in the atrium and also lower mean voltages. So that's sort of part of the theme that we've been looking at, the relationship particularly with more habitual consumption in AF.
Yeah, so maybe it's a plausible link for reduction of alcohol.
Yeah, I mean, AF is a very heterogeneous condition. So in terms of the mechanisms, I think there's probably a combination of mechanisms. There's the effect on trigger, so acutely, autonomic effects, acute atrial electrical effects, and then sort of in the more long term, actually remodeling of the atrium itself. So perhaps, and then there's obviously the link between alcohol and other factors such as obstructive sleep apnea,
right,
hypertension, and alcoholic cardiomyopathy is being well described as well. So there's the potential link in various different forms, and again, in some patients it may be a relevant factor.
All right, so you have this observational study, you have some of this pre-study work, but then you have to show that reduction of alcohol actually makes a difference. So who are these patients who were drinking but then stopped drinking?
Yeah, I mean, this was a real challenge in the study, and actually when we ran the study, it was intended to run for 12 months. That's originally how we planned it. And then we actually had to shorten it to 6 months because of that challenge. Alcohol is ubiquitous in our society. So, and part of it was, it was in the end actually quite a selected population. We did have about 500 or so, just over 500 patients who we screened who were eligible, who did not wish to be randomised. So the key was this group of patients that were motivated, because at the end of the day, we really wanted to have a study where we had a degree of compliance. That was going to be key. We know that stopping drinking in our population, where it's just part of our culture, is so difficult, and it will remain a challenge even with this study's findings. Right. But that was sort of the key, having the motivated patient group and then the run-in period. And then, as I said, even with that, we did shorten the study to 6 months to make it a feasible period where patients were willing to actually undertake it for that period of time.
And about 70 patients in the abstinence arm and 70 patients
70, yes. It was 140
control.
Patients in total with 1-to-1 randomization, correct.
And these were all comers to an AFib clinic who had what kind of AFib?
Yeah, so it was all comers. So the key was, it was paroxysmal or persistent. The key was that they were in sinus rhythm at randomization. and stable sinus rhythm as well. Again, we didn't want a situation, and that was part of the run-in phase. We didn't want a situation where had patients that were going to then change to antiarrhythmics during the course of the 6 months. We wanted a degree of stability.
Right.
So it was all comers. It was in the end about 2/3 paroxysmal and 1/3 a history of persistent AF, but in sinus rhythm at randomization.
Okay, and so then how do you know whether somebody's not drinking alcohol?
Yeah, so there was monthly contact with investigators. Patients kept a diary. They were provided encouragement and positive reinforcement during the contact if they were compliant. And then we'd also included in that urine testing for an alcohol metabolite during the follow-up. So again, I mean, that's a limitation of the study. It's self-reporting, but we were confident that we had, at least to some degree, a motivated cohort. So with that, and look, even with that, the total complete abstinence for the entire 6 months was achieved by 61% of the patients,
Okay.
so not all of them, but the vast majority reduced it to more than 70% of their baseline. So that's over 85%.
And if anything, that would bias towards the no.
Yeah, that's right, exactly.
So how big? You said in the beginning that there was a reduction in AF burden. So tell us how big of a reduction.
Yeah, so look, it was because of the heterogeneous nature. Look, it was not normally distributed. So the median burden was 0.5% in the abstinence group and 1.2% in the control group. So, but with the mean burden, it comes out to about 5.5 to 8% difference. But the real thing is, if you look at the actual spread of burdens, there were significantly more patients in the abstinence group that had no AF, about double that, and similarly more patients in the control group that had more than 5% burden. So, and that kind of fit with the Kaplan-Meier curve as well, with a 20% lower recurrence rate overall. So, the findings were statistically significant, and certainly, anecdotally, there were certainly some patients that benefited more than others.
This is, were there any key secondary endpoints that are of note?
Yeah, so we noticed, we definitely had a 2.5 kilo weight loss between in the abstinence group. So a modest reduction in weight, and also a reduction in systolic blood pressure as well, just over 10 millimeters of mercury in the abstinence arm. There was a small reduction in the control arm, but that was also, that were the two key secondary endpoints that were also significant.
Well, and this is provocative, right? Because reducing alcohol intake or stopping drinking, that's a significant thing. I mean, what do you think about the clinical implications, and how will you translate this to your patients?
Yeah, I think it's a really, really important question. I think in the AF population, I think the key message is, to take an alcohol history, just like we see coronary artery disease as a condition that's heterogeneous and has lots of risk factors. Similarly, AF, when you're seeing the patients in the clinic, it's not just about prescribing the antiarrhythmic, but going back a step and looking at their weight, sleep apnea, and then alcohol intake as well, and potentially in a trial of abstinence would be something that we would potentially recommend, particularly in the higher levels of alcohol intake. I think in the broader population, again, there are some unanswered questions. I guess there's obviously extensive epidemiological data and the U-shaped curve, and whether mild amounts of alcohol have cardioprotective benefits. We didn't look at that specifically. The focus of this study was on AF burden, AF symptoms, but that remains an unanswered question. And at the end of the day, it's part of the discussion to have with the patient and looking at their individual risk profile. And again, we now have a bit of data to be able to guide clinicians about additional lifestyle advice with respect to alcohol intake. We've always had that kind of anecdotal experience and observational studies, and now we have some randomized data.
I think I also want to point out to the listeners that this was a randomized controlled trial, and it was not funded, was it?
Yeah, look, it was an investigator-initiated study, so it didn't have any external industry support. So it was run out of 6 hospitals in Melbourne. Yeah, we're very grateful to our patients and also our collaborators that were able to complete this study. It was certainly it was a tough study to run it on various levels, but we got there in the end. So we're delighted to have got our numbers and to have these results that we can present.
Well, congratulations, and thank you for contributing to the AFib knowledge.
Thank you very much for the interview, John.
Okay.